This is Julia Brown dictating a visit today on 10-year-old Dante Tucker, African-American male who comes in today with leg pain. Pain's been going on and off for about 2 weeks now and has been getting worse within the past week, mostly in the right knee and some right thigh pain as well. He is limping and describes the pain as sharp at times. It gets worse with activity and sitting for long periods. Mom and patient do report that Tylenol sometimes helps, but the pain is pretty much constant. Rating a 4 out of 5 on the FACES pain scale today. Family history: maternal grandfather is deceased from CVA. Maternal grandmother is obese and has hypertension. Maternal aunt and maternal uncle with diabetes. Mom is also obese, and the father's history is unknown. Patient is like I mentioned, African-American male who was born at 37 weeks gestation via C-section with no difficulties. Diagnosed in 2009 with diabetes type 1 and is followed by a pediatric endocrinologist. He has had recurrent ear infections as a toddler. He was hospitalized in 2009 where he was diagnosed with the diabetes. Past surgeries: he's had tubes in both ears 2004 and 2005. His past ER visits: he went to the ER twice for hypoglycemia in 2009 prior to being diagnosed with diabetes. Lives at home with mom and boyfriend. Parents are divorced since child was a toddler, and the biological father is not involved. Mom has been divorced 3 times, and patients worried that mom and the boyfriend will separate because there has been some fighting going on. Patient is home alone after school. Allergies: no known drug allergies at this time. Medication: his insulin regimen. He's getting Lantus 10 units at bedtime, and Novolog to carb ratio is 1:22. Family's been struggling with following diet modifications for the diabetes diagnosis. Mom's working after school now, so the patient's responsible for meal preparation and counting his own carbs. He is pretty active in sports, likes to play football. No trouble going to the bathroom, follows safety expectations, wears a seatbelt, no guns in the home, and does ride in the back seat, sleeping throughout the night in his own bed. Immunizations are up to date. Hearing and vision screening at age 5 were normal. Not been to a dentist in over a year. Lead screen at age 2 was less than 2. No problems with growth and development. He is large for his size, but no issues as far as developmentally. Review of systems is negative, except for musculoskeletal, where patient and mom describe about the knee pain that started 2 weeks ago. Physical exam: vital signs 97.9, temp, pulse 85, respirations 18, blood pressure 100/62, height is 140 centimeters, falling within the 50th percentile, weight is 45 kilograms, falling within the 95th percentile. Physical exam otherwise is negative, except for musculoskeletal again. As far as lower limbs, gait with right leg externally rotated during ambulation. Mild right thigh atrophy is present. Limited abduction of right hip. Limbs appear to be equal in length. Spontaneous movements of both lower extremities. No fusion of digits noted. Right leg is externally rotated at rest. Assessment today: 1, knee pain. With concern for SCFE, we're going to go ahead and do some x-rays, and then following results of the x-rays, we will then determine if we need to refer to an orthopedist or hospitalization. X-rays: AP pelvis, frog leg lateral views of the pelvis. Assessment number 2, type 1 diabetes, is stabilized right now on current medication, so we'll continue the patient on his current insulin regimen. Number 3, overweight obesity. Based on his BMI falling within the 95th percentile, he is considered overweight. And then the final assessment, family circumstances. I'm just going to discuss with mother options for after-school care due to safety issues with diabetes and counting carbs and medications. Discuss maybe family member or after-school care. And then we will discuss further at follow-up visit. If there's no plan of action, we might refer to DSS for other possible resources that may be available. Education, pretty much just educate on diet and exercise with the diabetes, making sure they check blood sugars, making sure that he's going to the dentist at least twice a year, screenings, BMI, always wear a seatbelt as mentioned earlier, and reinforce physical activity.